As I mentioned, my name is Nancy Ross Vacca, and my background is I started out my professional career as an intensive care nurse and head nurse, went on to do family therapy, and 24 years ago, I was introduced to Market America and the products, the isotonic products, and they really supported some healthy changes for myself and my family. So much so that, as for many of you possibly, I was introduced to the company and started working with them and felt like I really found the spot that was very valuable to me when nutraMetrix was launched, because I'd seen such an opportunity to empower my customers to support a healthy lifestyle for themselves. And then when the company introduced nutraMetrix, it was an opportunity to empower so many more people in our community with the training programs that we have, the healthy lifestyle programs, the supplements, but do it in collaboration with their health practitioner and support our health practitioners. So today's presentation is the overview of the nutraMetrix business plan that will give you some idea in regards to the role of the nutraMetrix consultant a little bit, the value of that business account, as well as the 2 professional business accounts we have. So nutraMetrix is a complete suite, and I think the key word here is of customized, cutting-edge solutions exclusively for health professionals. There's a wide variety of products and services designed to better serve patients and generate an ancillary income level for the health practitioners or the practice. Relationships, we have relationships with thousands of partner stores also, which also add additional services and discounts for the health practitioners. There's been a changing paradigm in healthcare, and I don't think it's just been in recent years, it's been for some time. There's been rising business and drug costs for health practitioners, shrinking insurance reimbursements for them, and changing legislation that's affected pharmaceuticals and healthcare. And here's just a couple of the articles to give you an idea of some of the situations that have been going on for health practices. Interestingly, I met a young ER doctor recently, and she was telling me that her fellow medical students that graduated from medical school with her, the ones that were in general practice, were really struggling more financially than even some of the other specialty fields. So she really saw a need for additional programs for health practitioners to support the practice that they'd worked so hard and so long to get up and establish. So it was kind of just even a reinforcement from someone young just out of medical school. But you can see some of the struggles the practices are dealing with related to insurance and changes in legislation kinds of things. What's happening is they asked in a survey, are you spending more time or less time? You know, is it taking more time to do paperwork? And if so, what amount of time as a practitioner are you spending on paperwork? And 32% of the practitioners, you can see the bottom line, 32% of the practitioners are spending 20 or more hours a week related to either paperwork or online forms that are required for insurance companies and the practice just to meet business kinds of needs. And that's taking time away from the time they have with their patients. Yeah, that was the paperwork. I apologize. Now it's the patient time. How much time do they actually get with their patients? If you look at the top 3 categories, that's over 50% of the respondents said that they have anywhere from 9 to 16 minutes that they can devote to the time they have meeting with the patient to discuss their situation and discuss, recommendations that they might have. So they're having less time because of the challenges they're seeing. And they looked at things that were rewarding to the practitioners. What are you looking for? What value is there in the career path you've chosen? And its relationships with patients was a 27% reward, but it's something they've lost time with. It was 13% for making an income with a job that they really enjoyed. And in the 20% for maintenance and helping patients find answers. What's the most challenging part of the job? Obviously, so many rules and regulations was the top piece of that at 27%. Long work hours to accommodate the need to see more patients, dealing with difficult patients, work with the EHR system, and then difficulty getting fair reimbursement was 12% of a concern. So we do have an alternative with our nutraMetrix division with the company. What's interesting is some of the research has shown that 23% of family physicians now provide what we call ancillary services to their patients. They may have medication dispensing in the practice. Many practices are adding weight loss or healthy lifestyle programs because of the challenge that diabetes is across the age spectrum. Practices have in-office diagnostic tests, nutrition counseling, cosmetic services, and acupuncture and massage. And you can see from the diagram that some of the areas, the practice areas that are stronger in those add-on services or ancillary services would be orthopedics, anesthesiology, gastroenterology, ophthalmology, urology, plastic surgery, and then it shows you the categories going down. Maybe a little more specialized practices may not have quite as many of the ancillary services as yet. Supplements, research shows supplement sales have grown 5.4% to reach $43.4 billion in 2017. Twice as much is spent on people looking for support for healthy weight loss. 76% of the United States adults now take supplements, and that's up from 64% just 10 years ago. Who do they prefer to get their recommendations from? Patients consistently say that 55% of them say that they prefer to get the recommendation from their health practitioner who knows their health history, understands their health challenges. That's the more valuable recommendation to them. Next would be a dietitian. Most people are seeking them in the drugstore or Costco or some vitamin store where they have someone who just works in the store but may not have any even wellness background and certainly doesn't know their individual situation. Many of the most popular brands have very attractive labels. That's very great marketing that they're doing, but they contain artificial chemical dyes, artificial chemically synthesized flavoring agents, preservatives, disintegrating agents, and bulk fillers such as talc and starch, hydrogenated oils, and chemical coatings, things that we don't want to be taking in our supplements. And there's going to be two examples here. One is Centrum, very popular vitamin that gets advertised. And you can see the cornstarch, and there's hydrogenated oil. There's a number of different food colorings in there. The second one is the popular Flintstones Complete for Children, which also has sugar in the second line of its ingredients, as well as artificial flavoring and the artificial colors added. That's what's available at the drugstores. nutraMetrix is at the right place at the right time. It's helping health professionals generate additional revenue while providing their patients with wellness-based products and services that the patients are asking for. They're coming into the practice. And in some cases, I hear stories of them bringing in brown bags of vitamins they picked up somewhere and asking the doctor if they would be a good idea for them because they read about it somewhere on the internet, but they prefer their doctor's opinion or a friend recommended something to them. At nutraMetrix Customized Health Solutions, we believe that patients should have access to recommendations for healthy living and products that promote their wellness from their trusted health professionals. That's why everything we do is focused on helping the health professionals implement, once again, customized wellness programs based on their vision for their practice, their focus in their practice, but these supplements and programs that will benefit the patients. And we provide them with science-based nutritional supplements, revolutionary technology, wellness-based education systems, which are supportive to the practice, the staff, and the patients. We have our implementation consultants, our nutraMetrix consultants. And in this way, we're really changing the face of healthcare, one health professional and one patient at a time. At this point, we are a $40 million division of Market America's company with the sale of our nutraMetrix supplements and our support for the health practices and the patients. What we do is we identify the latest science-based, market-driven the latest market-driven products and very high-quality manufacturers. We offer a wide variety of our supplements, and our formulations are all done in a synergistic formula. We base our formulation of our supplements on peer-reviewed research, and if there's a patented ingredient in that research, that's the ingredient we use in the formulations that we develop, as well as we use it in the amount that showed an effect in the clinical studies, which really makes a difference. We don't manufacture the products ourselves. We use reputable manufacturers to manufacture our supplements. We have a commitment to quality. Strict quality control guidelines are required of our manufacturers, and we're able to check on those things. Specifications are set for raw materials and finished products. Our raw materials are sourced with certificates of analysis. Products are manufactured using standard operating procedure in manufacturing facilities that are audited on a regular basis for good manufacturing procedure compliance. Our products are inspected at our warehouse for damage, label accuracy, appearance, taste, and odor prior to even releasing the supplements. And the way we quality control the supplements, that's a real value to both the patients and the practitioners, because the practitioners know they're going to be getting a consistent supplement that they can then judge if it is making a difference in supporting the patient, or if their clinical decision, they want to make some changes, but they know they can count on a consistent supplement, which is really important. In our isotonics capable supplements, for those of you who may be visiting on the Zoom conference today, our isotonics line are all powdered vitamins that are formulated to be mixed with water. And when mixed with the appropriate amount of water and the supplement, you get an isotonic solution. They're a superior nutrient delivery. They have exceptional quality control measures used again, quality sourcing of ingredients, and comprehensive and synergistic formulations based on some of that science research I was describing to you. So the value to our health professionals is we get better delivery, better compliance with the patients, and therefore better results. I think that has been one of the key things I've found in the practices, the comments back about the compliance, that patients are willing to take them because they're easy to take, they're pleasant tasting, and the patients see a difference when they're using our supplements, so they're more motivated to continue using the supplement to support and generate the results. Patients find, as I said, easy value, great tasting, and they can really feel the difference. Value to the health professional with our ability to customize supplements. That gives unique formulations that are just available through that practice. The practitioner has the opportunity to design a unique custom supplement for an individual patient, or there may be a need for about 80% of their patients. I'll give an example. Maybe it's joint health support. Or healthy inflammation levels. They'll design a supplement using the vitamins that we have, our isotonic vitamins, and put together a customized product that's Dr. Smith's. Could be general health supplement, or it could be something else that they decide to designate, but it's something that's only available through their practice because it has their doctor's name on it. And they're able to make combinations that they would see as valuable for the patients. Patients like it because it's one-stop convenience, it's simplified, customized nutritional support, and they can have an auto ship set up to have refills done, so it makes it very convenient for them. We also have a gene SNP program that's only available through health practitioners. It tests 48 different genetic variations. It's comprehensive for health practitioners with a gene SNP guide. And the Health Action Plan supports each individual's metabolic and fitness needs. For the health professional, it's knowledge of the nutritional requirement, nutritional status, and genotype that can be used when they're customizing a wellness program for their patient. It totally takes the guesswork out of some lifestyle recommendations they would be making. And it's a unique service that creates added value for them. It's a laser approach to customized nutrition for optimum wellness. Patients are looking for options that match their lifestyle and their genetics. Patients are aware of genetics. They know of some of the genetic testing kits that are advertised. So they're aware of some of the value of having an idea about their genetics. What they have with their health practitioner is the ability for them to do the assessment and then provide them with information as to supplements, wellness support for them that's unique to them. The TLS difference for healthy lifestyle or weight loss programs. It's a science-based weight management program. We have weight loss supplements that maximize the results, and we have excellent online support tools for the health practitioner, the staff, as well as the patients to have access to, with recipes and educational videos on the website. It's a very supportive website. For the health professional, it addresses an immediate need for patients and a bottom line with weight loss. It provides solutions for weight loss, body fat loss, but because of the style of our TLS program, it's based on real food. The patients can lose the weight working with their doctor that is in the goal that they've established for themselves, but they're able to maintain that fat loss because they really learn how to eat healthy and use the supplements for support. So they're not just going on a shake diet and then going back to the old way they were eating. They really do find the value. For patients, the weight loss system provides effective and long-term results. Having worked with TLS a great deal myself with private clients as well as supporting the practices, the patient or the client's commitment to continue with their changed lifestyle is the benefits that they see, the increased energy that they see, their better focus that they have, the fact that the inches are down, so they're back into clothing that's something that's more comfortable for them. But the change in their health, a common response I hear from clients is, wow, I thought you only felt this good when you were 20 or 30. I didn't know I could actually feel this healthy again just by the fuel I'm choosing to eat and using the supplements. So practitioners are seeing the same kind of results. It's a valuable system. The nutraMetrix consultant is a partner in the implementation. They provide practice assessment and proposals. They do customized implementation plans. They can do staff training and education. We also do ongoing support and monitoring with the practice. So the personalized consultant has the practitioner and the practice's best interest in mind. The patient value for the nutraMetrix consultant is there's convenient solutions for optimal wellness from a trusted source, their own health professional, and that person is supported by the consultant. I just had a meeting with a practice recently who made the comment to me that the way we approach practices and the way we support them is so different from some of the other groups that they have coming in who are really more of a sales situation. But ours is more of helping them implement something around their vision, supporting the activities that are already going on in the practice. They were really, really appreciative of exactly the comment they were saying. They're having their best interest at heart in their patients. Value to the patients. With our nutraMetrix online support, the website that the practitioner has, there's educational support, there's detailed product information, there's nutritional blogs, and there's a NutriPhysical, which is a health and wellness questionnaire that the patient can take, and based on their answer, there's supplements that are recommended. Those supplements then can be discussed with their practitioner to decide a timing as to when they might want to start, which supplements, which combinations, as well as to increase the conversation they're having with their practitioner. There's online 24/7 convenience for ordering with the website, easy to search and navigate, cashback rewards for the patients, and we do have the ability to set reorder alerts or auto ship. And it's an automation for the office. It's a simple implementation because we're leveraging technology. There's a customized staff back office for easy management so the staff can get in and place orders for the patients, record orders that are being sold from the practice in combination with things that need to be ordered if they don't happen to be available. So it's a very easy system. And then, of course, the patients can reorder online themselves. The nutraMetrix program is systematized and streamlined for easy implementation. We have a complete marketing support system via print and digital media. So we do have wellness catalogs, product rack cards, patient handouts, posters that can be put up in the office or in the patient visitation rooms, waiting exam room area displays, and patient education seminars that can be provided. nutraMetrix consultant does a discovery meeting to assess the practice needs and submit a customized proposal based on what was shared in that initial meeting. Health professionals have the opportunity then to evaluate the proposal and make necessary adjustments to fit their vision for the practice and the time frame in which they'd like to implement. nutraMetrix consultants support the implementation, training, and the ongoing success of the practice to help meet the health professionals' goals for where they would like to see their practice grow to. The nutraMetrix business model has two ways of earning income. One is earning just retail profits from the sale of the supplements. Starts with simple implementation in the practice, and the retail profit range is from 30 to 50% gross retail profit. There is also an opportunity to earn additional commission-based income, and that commission is based on the business volume points that are associated with all of our products. Our products have a wholesale value, a retail value, and then they all have a point value, and the points are what are calculated toward the commission income. The earned commission can be anywhere from $300 to $3,600 in a week per business development center that is set up with the account, whether it's the the consultant or the health professional. So a scenario, this will give you an example of what a proposal will look like when we're working with the practice. If this was a practice with 5,000 patients, our typical goal is to look at an implementation of about 10% of the patient base over 12 months. So this is something we're going to do over time, not all at once. They may have done a survey with their patients, and 65% of the patients may have responded that they would be interested in a wellness alternative, and we have these surveys available for them. The implementation goal for the first 12 months is, as I said, 10% of the patient base. So we're going to start out with, we're going to look at approximately 500 patients on a wellness protocol by the end of the 12-month time period. They give an example here. In order to accomplish that, you would need about 2.5 patients per day introduced to the wellness protocol that they were committing to. Well, if you look at that over a week span, it comes out to about 12 patients a week that may be adding the supplement that they're focusing on, that they're going to get started on it and then use it on a monthly basis. This is going to give you an example of what it would look like if we're just looking at the retail profit. And what it's showing you initially is under the HP cost box. The cost to the practitioner for the daily essential packets is $55. The suggested retail is $77. So that profit margin is going to be $22. If there were 25 patients ordering daily essentials in a month's time, this is a monthly retail profit, there would be $550 profit to the practice. And as you can see, it multiplies up. For 100 patients, it's $2,200. For 250 patients, it goes up to $5,500 in monthly retail from daily essential products boxes. If we were looking at a medium-sized implementation for the practice where they would do a customized vitamin of the multivitamin, the B complex, the calcium, the OPC, but this practitioner chose to also add vitamin D3 with K. So he's adding an additional vitamin and making up a customized cocktail for his patients or her patients. The health professional cost on that item would be $93.55. Suggested retail is $123.02. So the retail profit is going to be $29.67 per patient purchase. And once again, they give you the numbers and show you what the value would be. With 25 patients, the retail profit for the month goes up to $742. You bump up to 250 patients, and you can see that retail profit goes up to $7,417. So even on the retail profit alone, that can be a considerable increase revenue for the practice to support practice activities and goals for the practice. The next picture here shows you what the add-on value is when you look at the commission income that also comes with the business volume points from the sales. And I know sometimes these graphs, if you're not familiar with looking at them, they can look a little bit confusing. So I'm going to try to walk you through as simply as I can. In the top section, they're just looking at the monthly retail profit, and they are listing what the business volume points would be. So the numbers are the same as the last graph we looked at. For 25 patients taking the daily essential packets, the retail profit per month would be $550. There would be 1,000 business volume points generated. For 100 patients, the retail profit would be $2,200, and 4,000 business points would be generated in that month. This lower area on this graph looks at total annual profit for the practice. So it's going to give you the retail profit for 12 months. If you had 25 patients, that the retail profit was $550 a month, the 12-month profit would be $6,600. Commission earned would be $1,800. So the annual earnings on 25 patients would be $8,400. If we bump over to the 250 patient column, their retail profit for the year, the retail was generating $5,500 a month. So in 12 months, that would be $66,000 added to practice revenue. And the commissions based on the business volume of 10,000 points per month would be $18,000. So for that particular practice, if 250 patients were ordering the supplements, the daily essentials, on a monthly basis, there would be an increase of $84,000 of revenue coming into the practice. And these are what the information looks like when we're presenting it to the practitioners. We're able to put the numbers in for the amount of patients and which supplements they would like as small, medium, and large to give them an idea of what the numbers look like. This is showing you the income with the custom cocktail. So that the same 25 patients using the custom cocktail, if you look at the total earnings at the bottom, are $11,604 with the combined retail and commission, where if you bump up to the 250 patients, there was $89,000 in retail profit for the 250 patients a month, and the total with the commission was $117,000. So there's some substantial additional revenue that could be used in the practice to support practice goals. It could be maybe being able to retain employees because they're able to offer raises. Maybe there's improvements to the practice they want to do for the patients. So it's some serious additional revenue being able to offer the supplements through their own practitioner with the education of the doctor through the practice. We have different accounts available through nutraMetrix. Our Health Professional One account, which is the introductory account. This is a simple introductory account designed for a health professional or a small group practice focused on the success of their own practice. It's simple, it's easy, it's profitable, and it's automated. At any time, a Health Professional One account, health professional can choose to upgrade to the HP Executive account whenever they choose, if that's something of interest for them. The HP Executive account is a full access account with nutraMetrix. So this is an advanced account option designed for health professionals who want to leverage either a number of practitioners in a practice or if they're looking to leverage their referral network. As a nutraMetrix consultant, we are non-health professionals, but we do have a full access account. So this is an advanced account option for us, designed for individuals who like to work with health practitioners and leverage our solutions with their referral network. And this is going to give you a little information on how commissions work for our nutraMetrix businesses. The company automatically tracks the business volume commission through the business centers that we have. All orders, whether they're placed for inventory in the practice or whether they're private nutraMetrix website orders, still count for the business volume toward commission. And practitioners in the HP One account automatically receive commission checks when their business volume criteria is met. So when volume comes up because of patient orders, practice orders, the company is tracking that volume, and when the computer system finds 1,200 business volume points on each side of the practitioner's account, there is a $300 commission check that is rewarded at that point. When there's 2,400 points found on each side of the business account on that Friday, another $300 commission check is cut for the practice. When the practice reaches the level of 3,600 business volume points, that's total, on each side of the account, there's another $300 commission check earned. And when the account achieves a level of 5,000 points on each side of the business account, a $600 commission check is given for a total of $1,500 potentially available for earning on the HP1 account in a weekly time period. Okay, to earn additional revenue for the HP1 account, they can introduce their nutraMetrix account consultant to their own existing referral network. The nutraMetrix consultant then can help the practitioner build a community of wellness-minded professionals to help increase overall sales. The model benefits multiple health professionals in one practice or supports multiple locations and large groups. The system still tracks purchases and sales made by the health practitioner as well as the wellness team and tracks those orders. The practitioner and participants receive 100% credit for volume generated within their organization. And what will happen in this scenario is very similar. Volumes coming up from other practices at 100%. The computer is still calculating at the same amounts for each of the commission checks for the $300, $300, $300, and then finally the $600 commission check for a $1,500 weekly income potential based on the business volume of the supplements. And then why do we offer an advanced option? It provides more income through shared revenue stream that supports the practice and patient care, whether within a large practice or among outside referrals. It's still based on business volume generated by the entire organization. It can provide ongoing income and can continue after a practice closes, so there's some interest for some practice in using this as a plan for retirement. It provides a commission system to support large practices, and it provides an opportunity for success for both individual health professionals as well as groups simultaneously. So health practitioners here can refer health professionals who need wellness for their patients or revenue and support the implementation practice through the nutraMetrix consultant. This will just give you some ideas of different types of health professionals, as well as people that might be interested in working as a health consultant. We obviously got the nutraMetrix consultant position listed there, but someone in your team who is a TLS coach really enjoys working with the TLS system may also be interested in looking at a nutraMetrix consultant role where they can help to bring the TLS program into practices. Fitness trainers are often a great contact looking for people who might be interested in working with health practices because they're already looking at nutrition frequently for their own clients. They're already looking at supplements. They may even be someone who's a trainer in our system and they're using supplements in TLS with their clients. They have contacts and referrals with health practitioners in the area via networking with their clients as well as their own professional network. So they are often great contacts to talk to about the nutraMetrix role. And then what the consultant does, we refer, teach, and we support health professionals. Staff members can become trained as nutraMetrix consultants to support the success of the practice inside and out. Staff members can become certified TLS weight loss coaches to support success in the weight loss programs. Our compensation system can provide income to the staff at no cost to the practice, which is a huge benefit. And individuals who fit as outside nutraMetrix consultants can support referral development outside the practice to add to the growth of the practice. This is option 2 and option 3. So this is the business model for both the health professional executive position as well as the nutraMetrix consultant. Full access, significant income potential to leverage additional business development. Additional requirements include training and basic monthly requirements that both the nutraMetrix consultant and additional nutraMetrix consultants can support development of additional locations or referrals in this process. They partner to provide business development support, the nutraMetrix consultants. So you can see we've got a couple of consultants identified in this team as well as other practitioners. And the volume is moving up at 100% in the same process as the other payment plan. And the same numbers are calculated for commission income. So 1,200 points on each side of the account generates a $300 commission check. 2,400 on each side is another $300 check. 3,600 points on each side generates that third $300 check, and then 5,000 points on each side of the account allow for a $600 commission check. There is the option in these advanced accounts to actually get a management bonus also that's related to volume earning by partners on the team. So in the advanced, in the executive account, in the nutraMetrix consultant account, they have the ability to earn $2,100 a week, which is different from the HP1 account that is at the $1,500 a week. Annual earning potential is $109,000 in this business presentation. More income can be earned, and there's an option to increase income by activating additional business centers. A simple way to describe that would be as if you had, an office in separate parts of town, or say a franchise business that you had sites in different areas. That's kind of a visual that helps me understand it. By leveraging additional nutraMetrix consultants, you can develop new business as a practitioner or as the consultant. Additional business development centers are available through a reentry program that the company has, and there's full information on that in our compensation plan with further details. But basically, you can see the number 2 center in this example already had the left side of it built when the number 1 center was building out the team of business partners and health professionals. All this health professional had to do was go in and identify another nutraMetrix consultant, and through them add some additional health practitioners, which then built the right side of their number 2 business account. And they have the opportunity now to earn that same $2,100 potentially on the number 2 account as they had the ability to earn on the 1. They can repeat this process with the number 3 account, which allows them to earn another $2,100 a week as a maximum payout, which means that with the number 1 center also processing at $2,100 a week, there's a potential to earn $327,000 if all 3 centers were maximizing their volume and their commission income on a weekly basis. Here's a little bit more information. It's kind of give you an overview summary of the different accounts. The first area they look at is startup cost for a health professional account. The startup cost is $159.95. An executive HP account is also $159.95. The nutraMetrix consultant account is $129.95. All accounts have a back office monthly fee that is paid. It's $21.95, and it gives the health professional 1 account, the HP exec, and the nutraMetrix consultant access to a back office where they can manage their business. There's all kinds of resources and support materials. There is no minimum order required in setting up the account, but their number 1 business account needs to have at least 200 business volume points ordered through it before it qualifies to start accumulating the business volume points toward a commission check. Business income is capped at $78,000 per year on the HP1 accounts. So if you're working with someone who has an HP1 account and their income's getting up closer to the $78,000, $80,000, it's if they haven't visited an HP executive account before that time, it's obviously a good time to talk to them about the options they could have to increase their revenue looking at the executive account. The executive account can earn $109,000 per year per business development center, and there's no limit on the number of centers that they can develop for business income. The same thing is true of a consultant. The HP1 cannot set up accounts, but the health professional executive account and the nutraMetrix consultant can set up additional accounts. Monthly annual requirements. We all have that $21.95. There's an annual renewal required for the health professional 1 account. There's also an annual renewal required for the HP executive and the nutraMetrix consultant. But in addition, for the executive account and the NC account, there's an auto ship that's required. There are no mandatory training requirements for the HP1 account. There are basic business training requirements for both the executive HP account and the NC account. And a nutraMetrix consultant, a business owner who would like to work in that field, is required to take a nutraMetrix training. They have upgraded options on that now, and if you have nutraMetrix 101s and 201s offered in your area, there is the opportunity for someone who takes the training and purchases a ticket for the next nutraMetrix training. They can contact the company between the time they take their 101 and 201 training and the time that that nutraMetrix consultant training is scheduled, and they can opt into 3 months of active status on their nutraMetrix account now, so they can begin to start working with accounts, which is a great option and opportunity for them if this is really an area of focus. Accounts required, none of the, how many accounts are required to earn commission? There are no accounts required to earn commission for an HP1 account. For the executive account, they would have to have referred 2 accounts, 1 on each side of their business, to the company, and the same thing with the nutraMetrix consultant. So for next steps for health practitioners, it's to schedule that discovery meeting with the nutraMetrix consultant and determine what the customized solutions would be to meet the needs of the doctor's vision for his or her practice, as well as what they've identified as the needs for their patients. Customize a selection of products and services. Opening that nutraMetrix account that we talked about for the $159.95 that has the renewal at $129.95. The introductory nutraMetrix account does come with their nutraMetrix website and support materials. They will start then they'll have a setup on their $21.95 back office account fee that allows them access to their account right away. And they do have access to the deductor widget for tax tracking expenses. Then next step from there is to schedule a staff implementation to train them to help understand the wellness vision for the practice and to learn how to efficiently support what the practitioner has as a vision in the practice in a way that's going to fit with the protocol that the practice is already using, with the way they bring their patients in and who sees the patients, who follows the patient through the office, what their routine is. The more we can adapt what can be offered and customized to the routine that's already being used in the practice, it's much easier to implement. It's more easily accepted, and I think the value is seen more. That's really been my experience. There's the opportunity to train key staff members to support revenue-generating wellness programs and to measure ongoing progress and make adjustments to ensure success for both the patients and the practice. So initially, this is a program where you're working in the practices and you're probably in your practice at least once a week, or someone from your nutraMetrix team is meeting with the practice, particularly in the beginning, to make sure that questions are answered and implementation is going smoothly. We're able to adjust to any challenges that come up and creatively help them set things up so that they can accomplish what they're looking for with the support of the programs that we have. So as nutraMetrix consultants in the nutraMetrix program, we're committed to the success of health practitioners. We have training available for nutraMetrix professionals. There's a nutraMetrix implementation and product training. We actually have that tied into our annual nutraMetrix convention for 2019. It's the last weekend of March. And it's a great opportunity for the practitioners to arrive on Saturday for a nutraMetrix training for the practitioners. And that's an opportunity for them to learn about the programs we have, the supplements we have, and have that learning in a situation where they're there with other health practitioners, some who've already implemented programs, so they can get experience and hear from the other health professionals. One of the strongest comments I hear from practitioners specialty areas or fields from where they come from. They typically are used to going to a training with pediatricians or a training with orthopedic surgeons, and when they come to our nutraMetrix training, it's a mixed training of professionals from all different fields, and they really appreciate the information they learn about how the supplements and the programs have worked with patients in different practices. We also have staff or health professional training for the nutraMetrix consultant, and that teaches staff members, and sometimes the practitioner likes to attend those to learn ways on how to support the success from the inside out of the practice. So the next step for health professionals is to get questions answered, to try some of the products. It's really important for practitioners who are looking at nutraMetrix as an option. It's difficult to tell the patients that things taste well or that they're working if they haven't had a chance to try them themselves. So I know that's a real value for the practitioners to be able to try some product and find out what's working for them. And sometimes that adjusts the customized program that they're deciding on for their practice. The nutraMetrix consultant can then customize a proposal to suit the unique needs of the office and evaluate if nutraMetrix is the right fit for the practice at this time for implementation.